Hello, my name is Robert Schrupp and I am a physical therapist. The name of today's program is How to Prevent Falls in the Elderly at Home. As we do with all of our programs, what we are going to do is we're going to break this into the three main components of what you should study in order to understand this topic. And the three main components with this particular topic are environment, elderly ailments, and equipment. Okay, as I mentioned, the three main areas are elderly ailments, equipment, and environment. As you might notice, I kind of went with the E pattern here, just to try to make it a little more memorable. Elderly ailments. As we age, everything begins to deteriorate, as we unfortunately all know, and that includes all the things that affect your balance. Your vision, even your hearing, the balance center within your ears, your strength, flexibility, and sometimes we can compensate for some of that by making changes to ourselves, but more often than not we can make changes to our environment and to the equipment we use to try to help compensate for those deficits. But let's start off with the human body itself and discuss some of the things that we can make changes with. The first is you should, as far as wearing shoes, you always want to wear a non-slip, low-heeled shoe that fits snugly. You shouldn't walk around in stocking feet for obvious reasons. You can slip. But the other thing that I've seen in a lot of the elderly is, especially some of the women who have been very fashionable through all their lives, is of course they want to continue to wear the high heels. And I don't think it's hard to understand that if you're up on your heels, like, you know, up on your toes, that your balance just is not going to be as good as if you have a good base. So you need to try to talk yourself out of those high heels. The other thing that's very common, again more among women than men, is they tend to carry a really heavy purse. And the more that you're carrying something around, even at home or when you're out and about, and if your balance is a little questionable the way it is, that extra weight's going to throw you off. So try to lighten your purse or your carrying bag. You have to be aware of pets. I've had a couple patients who ended up breaking hips because their pet, their leash got wrapped around them, or the dog or the cat got underfoot and down they went. So something to consider with regard to that area. You really want to use an appropriate gait aid if it's been determined that your balance is not up to par. And by the way, this is probably a good time to mention this. A physical therapist can do a balance test on you. And that balance test can determine whether or not you are at a high risk for falling, a moderate risk of falling, or really at a low risk for falling. And really it's good knowledge to have. And if you are at a high risk for falling, you should be using a cane. I can tell you also from experience that a great many people are too proud to use a gait aid. They just think that that's for old people, and unfortunately there's an old proverb that says pride comes before a fall, and I know there's probably a double meaning to that, but in this case it's very apt. If you become too proud and don't use a gait aid, you may fall, and falls can be devastating. They can send you on a path of illness, and that's very hard to recover from. So we'll talk about equipment and what possible gait aids to use in the next segment. Vision is obviously a big one, and in fact when we talk about environment, you're going to see that the first 5 items have to do with vision. Especially with lighting, to make sure that you have adequate lighting, especially at night when you get up. So we'll talk about that. This is one that I did with my own parents, and it's a really easy one to do, but it's a very important one to do. You don't want to have someone who has somewhat questionable balance reaching down below quite often or reaching high above quite often. Especially you don't want them standing on stools. or chairs. If they have to stand on a stool, try to get one of those stools that has a built-in handle on it, and that's nice and sturdy so they can hold on to the handle and step on the stool. But beyond that, what you want to do is take the things that they use on a daily basis and you want to store them somewhere in this range here. You know, somewhere about shoulder height down to waist height, and that way they don't have to bend over. And we went through my mom and dad's entire house and did that, and that made it a lot easier for them to not have to even put their balance to the test. Numbness is something that you really can't do much about. Some people have numbness in their feet due to diabetes. Again, with that, what I'd like to see is a good fitting, wide base shoe that'll help you maintain your balance, and using a gait aid in that type of situation. Flexibility is important. Judgment. If you feel dizzy or lightheaded, sit down and stay seated until your head clears. This is certainly the situation when you wake up in the morning. We very much encourage our patients to get yourself up on the side of the bed and sit there for a while before you stand. Very common sense, but a lot of people don't do it. Don't get up right away and you feel dizzy and you're not ready for it.